spinal cord lesions can be categorized into either complete spinal cord lesion or incomplete spinal cord lesion. You can remember in the previous videos, I discussed about the anterior and posterior spinal artery syndrome. Those ones, they are part of the incomplete spinal cord lesions. But then there are some other incomplete spinal cord injuries or lesions that I'm going to discuss now. So when you now talk about the spinal cord lesions, in terms of complete or incomplete, when you talk about the complete spinal cord injury or transection, that means you divide the spinal cord into two parts, upper part and lower part, using a sharp object. For example, during this endeavor fight, once they prick your back with a very sharp knife, they may easily, especially at the level of the midline there, once the knife goes in between the vertebral bones, it can easily divide the spinal cord into two, to completely divide the spinal cord. That is what you call complete spinal cord transection. You get it? So, trauma is one of the common causes of this complete spinal cord transection. Or somebody may have an accident. Accidentally, after having the accident, one of the parts of the vehicle, maybe one of the sharp object of the vehicle after some assaulting, may penetrate the spinal cord and break it into two. Or maybe by some assaulting, somebody is thrown out and then may break the backbone, and the backbone and the spinal cord can also get torn together. So trauma is mainly one of the common causes of the complete spinal cord lesion or transection. So when we talk about complete spinal cord transection, once that happens, there are no sensation at all. There are no motor movement at all. So both motor and sensory sensation are all lost. That is with regard to the total or complete spinal cord transection. So the complete transection of the spinal cord depends, the features that one can see in the clinic depends on the level of the transection. So if it's at the level of the cervical region, there is what we call quadriplegia. That means both upper and the lower limbs are all going to be paralyzed because the motor movements, the motor information coming from the cerebral cortex down into the spinal cord are being cut off. So that means there is upper motor neuron paralysis of all the limbs, upper limbs, lower limbs. So that's what we call quadriplegia of upper motor neuron type. So that's a spastic paralysis. But if it is below the cervical region, that means at the level of the thoracic region, lumbar region, there you have what you call paraplegia, because if it is below the cervical region, you know your brachial plexus ends at the level of T1, T2 maximum. So below that level, all those nerves supplying the upper limb are spared. So the upper limb is going to be functional, but the lower limbs are going to be paralyzed if the transection takes place below the level of the cervical region, maybe at the level of T3, T4, something like that. So the person is going to have what you call paraplegia. So all the lower limbs are going to be affected. Are you clear? So there is also loss of all sensations. Any sensation you can think of, pain, temperature, cold touch, pressure, fine touch, body position sense, you get it, 2-point discrimination sense, and what have you. Both conscious and unconscious sensation are all going to be lost. Similarly, remember that all these our parasympathetic and sympathetic nerve fibers they all pass through the spinal cord. So once you have a complete transaction of the spinal cord, all the sympathetic and parasympathetic functions are all going to be lost. That means control of our bladder. When we want to urinate, you are having lectures now. You feel like going to urinate, but because you are enjoying the lecture, you try to control your bladder so that the urine will not come out. So you have a bladder control voluntarily. But once you have this spinal cord transaction, that control is no longer there. So that person will be passing out the urine uncontrollably. Are you clear? So also when you want to go and ease yourself in the toilet, you want to pass your pieces. Now you are feeling like going to toilet and pass shit. But because of the lecture, you are just controlling it. Somebody with that lesion cannot control it. The pieces will just come out without any control. So somebody with this complete spinal cord transaction, there is either quadriplegia if it's at the level of the cervical region, there is quadriplegia if it's at the level of the thoracic or lumbar region, there is also loss of all sensation, any sensation you can think of. There is also loss of all reflexes of our joints. There is also loss of autonomic function. So there is what? Loss of all the autonomic function. Loss of autonomic functions. So all these are going to be lost. This is with regard to the complete spinal cord transaction. As I was telling you, if at the level of the cervical region, it is even much worse, because there is going to be involvement of, especially if it's above the level of C4, there is involvement of the phrenic nerve, because phrenic nerve root is 3, 4, 5. So if it's at the level of C3, you are cutting off the phrenic nerve. So phrenic nerve, is responsible for supplying diaphragm. And diaphragm is the most important muscle of respiration for breathing in and out. So once you have that complete transaction, the phrenic nerve is cut off, and so breathing will cease. And so it is very dangerous if it is above blood level, so one will definitely stop breathing. You get it? So that is for the complete spinal cord transaction. There's also what we call Brown-Sequard syndrome. Brown-Sequard syndrome is also as a result of trauma most often. When somebody now has this trauma from endeavor fight in our own country, whereby you have a lot of people working with knives and pricking people by the side of the spinal cord, vertebral column, it can cut the spinal cord into two halves. So half of the spinal cord is going to be injured. So that means one half of it is going to be affected. If that happens, that is what we call Brown-Sequard syndrome. So once that happens, remember all the features, all the structures that are found in one half of the spinal cord. On this half of the spinal cord, we have fibers, sensation coming for conscious proprioception going into this posterior column. Are you clear? This dorsal column medial lemniscus pathway, this side. So there is ipsilateral loss of conscious proprioception. Are you clear? All this your body position sense, vibration sense, fine touch, 2-point discrimination sense, and what have you. These are lost on same side. Again, there's also loss of pain and temperature sensation. On the opposite side, that is contralateral loss of pain and temperature. Why? Because for pain and temperature, plus crude touch and pressure, once this sensation they come into the posterior horn, they crisscross to the opposite side. So once you cut this side, it is the contralateral side that is going to be affected. So the right side of that person is not going to feel pain and temperature and crude touch. Although it is the left side that is affected, but his all right limb will not feel pain and temperature. Are you clear? Because of this crisscrossing. There is also going to be, ipsilateral loss of motor function. If you can remember this, what we call the lateral corticospinal tract. After crisscrossing at the level of the medulla oblongata, the right goes to the left goes to the right. So if it is at the level of the the transaction of the code takes place below the area of the decussation of the medulla oblongata. So you have ipsilateral loss of motor function. But if you have a brainstem transaction above the level of the decussation of these pyramidal tracts, then you have a contralateral loss of motor function. But here we're talking about the spinal cord transaction below the level of the decussation of that pyramids. That is why we have ipsilateral loss of motor function with regard to the Brown Sequard syndrome. So that means that person will have what we call hemiplegia if it is at the level of the cervical region, maybe at the level of C8, T1 or T2, something like that. So somebody will have hemiplegia. That means the upper limb and the lower limb of the same side are going to be paralyzed, or they are going to be weak. If they are completely paralyzed, that is what we call hemiplegia. If they are not completely paralyzed but they are weak, that is what we call hemiparesis. Are you clear? So you may have either hemiparesis or hemiplegia of the same side. Similarly, as I told you before, you are going to have loss of both conscious and unconscious proprioception and vibration sense. Reason because this dorsal column is going to be lost of the same side. Similarly, the dorsal and ventral spinocerebellar tracts are also going to be affected. So we are going to also have loss of unconscious proprioception. Are you clear? Of the same side. That is what we call Brown-Sequard syndrome. Causes of this Brown-Sequard syndrome is to do with tumors. They can chop up half of the spinal cord. Trauma is one of the common causes, as I told you before. And also hematoma, that means accumulation of blood within the vertebral or neural canal that can compress the spinal cord of one side. And also radiation. When somebody has cancer of any part of the body, the cancer patient, they go for radiotherapy. We do it in America, we do it in ABU's area, we do it in several of the teaching hospitals in Nigeria. So that radiation can affect part of the spinal cord, can affect half of the spinal cord, and so it can cause what we call myelopathy of that half of the spinal cord where the radiation, affected it. So we can also have cord compression as a result of that tumor, swelling, maybe as a result of maybe tuberculosis, causing pus, and the pus now compresses the cord. So these are the common causes of the Brown-Sequard syndrome. And once somebody has that, there is contralateral loss of pain and temperature because of the crisscrossing of the fibers from the left to right or right to left. And so crude touch and pressure, the same thing. And also there's ipsilateral loss of motor function because there is, after the decussation, you have this lateral corticospinal tract of that side being involved. And so there is also loss of this conscious and unconscious proprioception of the same side because of the involvement of the dorsal column and also ventral and dorsal spinocerebellar tracts. So these are, the features one is going to present if somebody has this complete or incomplete spinal cord transaction. I'm going to break here.